Are you wondering how to improve your health and well-being but don't know where to start? Let's unravel the mystery together. You see, taking charge of your health begins with identifying the key issues impacting your well-being. It may seem daunting, but it's a critical first step. Whether it's stress management, dietary habits, or exercise routines, recognizing these factors is pivotal. Now let's talk about sharing your health journey. It's vital to have a safe space where your story can be heard without judgment. Active listening plays a crucial role here. It's not about criticism or pity. It's about understanding your unique experiences and challenges. Remember, everyone's health journey is different. Your obstacles, your victories, your story, they all matter. By identifying and understanding these key health issues, we can begin the journey towards improved well-being. Identifying health issues is the first step toward achieving better well-being. Navigating health information can be challenging, can't it? We're bombarded with information from every corner, making it tough to separate fact from fiction, and even harder to understand what it all means for our own health and well-being. Let's break it down. When we talk about navigating health information, we're talking about understanding both health-related and service-related information. This might include scientific research, dietary guidelines, exercise recommendations, or understanding how to access and use health services effectively. It's important to remember that everyone's health journey is unique. What works for one person may not work for another. So it's crucial to understand the information in the context of our own individual health needs and goals. Working with individuals or groups to navigate this sea of information is a collaborative process. It's about actively listening to a person's story, understanding their concerns, and helping them to interpret the information in a way that's meaningful to them. It's also about providing guidance on how to critically evaluate health information. Not all information is created equal. Some sources are more reliable than others, and some may be biased or misleading. So it's vital to understand how to discern quality information from misinformation. This process is not just about understanding information, but also about using it to make informed decisions about our health and well-being. It's about empowering individuals to take charge of their health, to make choices that align with their values and goals, and to feel confident in those choices. Remember, navigating health information is not a one-time event. As our health needs and goals evolve, so too will the information we need. Regularly reviewing and updating our understanding is key to staying informed and making the best decisions for our health. Understanding health information empowers us to make informed decisions about our health. Want to make changes to your behaviors and lifestyle choices to improve your health and well-being? Well, you're not alone. Many of us strive to adopt healthier habits, but it's easier said than done, isn't it? Let's delve into how we can effectively work with individuals or groups who have a similar goal. First and foremost, it's important to remember that patience is key. Change doesn't happen overnight, and it's crucial to respect each person's pace. Now let's discuss some behavior change tools and techniques. One of the most popular methods is the SMART goal setting. SMART stands for specific, measurable, achievable, relevant, and time-bound. This method encourages us to break down our goals into manageable steps, making them less daunting and more achievable. Another technique is the stages of change model, which recognizes that change is a process that involves progressing through different stages from pre-contemplation to contemplation, preparation, action, and finale, maintenance. Understanding where we are in this process can help you tailor our approach to change. Motivational interviewing is yet another effective tool. It's a counseling method that helps individuals resolve ambivalent feelings and insecurities to find the internal motivation they need to change their behavior. It's all about exploring and resolving ambivalence and centers on motivational processes within the individual that facilitate change. Lastly, let's not forget about self-monitoring, a technique where we keep track of our behaviors and outcomes. This can be as simple as keeping a food diary or tracking our physical activity. Self-monitoring helps us become more aware of our habits and patterns, allowing us to identify areas that need improvement. So, are you ready to make some changes? Remember, the journey towards better health and well-being is not a sprint, but a marathon. It takes time, effort, and perseverance. But with the right tools and techniques, we can make the process a little easier, a little more manageable. Changing behaviors and lifestyle choices can significantly improve our health and well-being. So let's embark on this journey towards a healthier future together. Ever wondered how to develop an actionable plan for improving your health and well-being? Now let's jump right into it. Developing an action plan is like laying down a roadmap for your journey towards better health. It involves identifying your destination, charting out the path, and setting milestones along the way. Behavior change tools and techniques play a pivotal role in this process. These are scientifically proven methods that can help you make sustainable changes in your lifestyle. They can be as simple as keeping a food diary to track what you eat, or as innovative as using a mobile app that reminds you to take your daily walk. The crux of these tools lies in their ability to make you more aware of your behaviors and provide you with strategies to modify them. They encourage you to reflect on your actions, understand the triggers that lead to unhealthy habits, and find ways to replace them with healthier alternatives. But remember, an action plan is not a one-size-fits-all solution. It needs to be tailored to your unique needs, preferences, and circumstances. This is where goal setting comes into play. Setting goals is an integral part of your action plan. Your goals should be smart, specific, measurable, achievable, relevant, and time-bound. They should clearly define what you want to achieve, how you plan to do it, and by when. For instance, instead of saying, "I want to lose weight," a smart goal would be, "I want to lose 10 pounds in 3 months by exercising for 30 minutes a day, 5 days a week." Your goals act as your guiding stars, steering you in the right direction. They provide you with a sense of purpose and motivation, helping you stay committed to your plan. And finally, it's crucial to remember that developing an action plan is not a one-time task. It's an iterative process that requires regular review and adjustments based on your progress. An effective action plan is crucial in addressing health and well-being issues. It's your blueprint for success, your guide to a healthier, happier life. So what are you waiting for? Start developing your action plan today. Did you know that there are services available to help optimize your health and well-being? It may seem like a simple question, but many of us are not aware of the breadth and depth of resources available to us. So let's delve into this. Navigating the vast ocean of health and wellness services can be daunting, but there's a method to the madness. the first step is reviewing what's out there and identifying what aligns with your specific needs. This requires a clear understanding of your health goals and the challenges you face in achieving them. Now, the beauty of the modern world is that there's an abundance of services designed to meet a wide range of needs. We're not just talking about your typical health clinics and gyms. There are nutrition counselling, stress management workshops, sleep clinics, and even financial advisory services that can help alleviate stress related to money matters. Why are these important? Well, our health and well-being are not just about our physical condition. They're tightly intertwined with social, financial, and environmental aspects of our lives. Acknowledging and addressing these wider issues is a crucial part of the health journey. But how do we find these services? A good starting point is your local community centre or healthcare provider. They often have information on available resources. You can also do your own research online. There are numerous platforms that compile and categorize services, making it easier for you to find what you need. Once you've identified potential services, the next step is accessing them. This could mean making an appointment, signing up for a program, or simply walking into a centre. Remember, the goal is to optimize access and choice, so don't be afraid to explore multiple options and choose what works best for you. In conclusion, it's essential to remember that we're not in this alone. There are numerous services out there designed to help us improve our health and well-being. By reviewing and accessing these services, we're taking proactive steps towards better health. Optimizing access to relevant services can significantly improve our health and well-being. So let's take that step, shall we? How can you measure progress in improving your health and well-being? It's a question we often find ourselves asking, isn't it? It's crucial to understand that our health and well-being journey is not a destination, but an ongoing process of growth and self-improvement. To ensure we're on the right path, we need to constantly review our progress. This can be done by reflecting on our initial goals and comparing them with our current status. Are we closer to achieving what we set out to do? Are we feeling better, happier, more energized? These are the questions we need to ask ourselves. It's worth noting that progress is not always linear. There may be times when we feel like we're not making any headway or even taking a step back. But remember, these are all part of the journey. It's these challenges that make our victories all the more rewarding. In reviewing our progress, it's also beneficial to evaluate our engagement with the service. Have we been actively participating in the program? Have we been utilizing the resources provided to us? Have we been open and receptive to feedback and guidance? Once we've assessed our progress and engagement, it's time to agree on an endpoint or closure with the service. This doesn't mean the end of our health and well-being journey, far from it. Instead, it signifies a milestone, a point where we can say, I've come this far and I'm proud of what I've achieved. It's also a point where we can decide on the next steps. Maybe we're ready to tackle more challenging goals. Perhaps we've discovered new areas we'd like to improve, or maybe we just need to take a moment to celebrate our achievements before moving forward. Now remember, the journey to better health and well-being is a marathon, not a sprint. It requires patience, perseverance, and a lot of self-love. And most importantly, it requires us to be kind to ourselves, to acknowledge our progress, no matter how small it may seem. Regularly reviewing progress is essential. in our journey toward better health and well-being. Because at the end of the day, every step forward is a step in the right direction. Let's recap what we have learned today. Throughout our journey, we've explored how behavioural science can be a powerful tool in enhancing our health and well-being. It is not just about understanding our health, but also about identifying the key issues that may be impacting it. This process requires active listening, an open mind, and the absence of judgment. We've learned that navigating health-related information is crucial. It's not enough to simply have access to information. We must understand it, take it in, and use it to make informed decisions about our health and well-being. This could be as simple as understanding the nutritional content of our food, or as complex as interpreting medical reports. Understanding this information empowers us to take control of our health, making us active participants and not just passive recipients. Then there's making behavioural changes. It's one thing to know what's good for us, and quite another to put it into practice. This is where behavioural science comes in. It helps us understand why we do what we do and how we can change those behaviours to improve our health and well-being. From quitting smoking to starting a new exercise regime, behavioural science can provide the insights and tools we need to make lasting changes. Next, we discuss developing an action plan. It's not enough to have a vague idea of wanting to be healthier. We need specific, measurable, achievable, relevant, and time-bound goals. Behavioural science can help us develop such a plan, providing us with a roadmap to better health and well-being. This plan takes into account our individual circumstances, preferences, and challenges, making it uniquely suited to us. Accessing relevant services is another important aspect we've explored. The world of health and well-being services can be a maze, but with the right guidance, we can navigate it to find the services that are most relevant to us. These could range from medical services to social, financial, or environmental services that can address wider issues affecting our health and well-being. The goal is to optimize access and choice, ensuring that we have the support we need to achieve our health and well-being goals. Finally, we discuss the importance of reviewing progress. Change is a journey, not a destination. It's important to periodically review our progress, celebrate our successes, and adjust our plan as needed. This review process enables us to keep moving forward even when the going gets tough. To sum it up, behavioural science can be our ally in the pursuit of better health and well-being. It provides us with the tools to identify health issues, navigate health information, make behavioural changes, develop an action plan, access relevant services, and review our progress. It's about finding practical, feasible solutions that work for us as individuals. Remember, health and well-being are not just about the absence of illness. They're about feeling good, both physically and mentally, and being able to enjoy life to the fullest. It's a journey, and behavioural science can help guide us on that journey, providing us with the insights and tools we need to live healthier, happier lives. Applying behavioural science to health and well-being can help us find practical solutions for a healthier and happier life.